Okay, I think we can go ahead and get started. Good morning or good afternoon. Thank you so much for joining us for our Research in Progress webinar series. My name is Carrington Lott. I'm the Deputy Director at Systems for Action. And if you're not familiar with Systems for Action, we are a national research program office of the Robert Wood Johnson Foundation. We are housed at the Colorado School of Public Health on the CU Anschutz campus in Denver, Colorado. And we fund research all across the country that aims at funding research that looks at aligning across systems, so your public health, medical, and social service systems. Today, you are going to be hearing from one of our research teams at the University of Washington on their project, Achieving Reach in Youth Behavioral Health and Wellness through Catchment-Area Community Governance. This team was funded in our 2022 funding opportunity, and this is going to be their first time presenting in our Research in Progress webinar series. So you're going to get to hear a little bit about what they've done to date since their project started in February, and you get to hear about what they're going to be doing for the rest of their year-long project that we're going to have them join the Systems for Action team on. Okay, so next slide, please, Maggie. Just a little housekeeping. So this is the agenda for today. You're hearing the welcome right now, and then I'll turn it over to the research team so you can hear more about their project. And then you will be hearing commentary from Priscilla about the importance of this research and how it's impacting the community. And then we will reserve the final 10 to 15 minutes of today's session for questions and answers. If you have any questions that come up at any point during today's webinar, please make sure that you locate the Q&A box at the bottom of your Zoom screen and enter in your question. Sometimes we do not have time to get to all of the questions before the session is over. And if that is the case, we will make sure that the research team has your question in hand and they can follow up after today's session. So with that, I think I'm going to hand it over to Dr. Walker so she can do an introduction of her team and tell you a little bit more about their research project.
Perfect. Thank you so much, Carrington. So I have the pleasure of introducing my colleagues, and then I'll provide a little bit of background and context for the project and our research aims. My name is Sarah Walker. I'm the PI of this particular research project. I'm an associate professor in the Department of Psychiatry at the University of Washington, where I run a center called the Co-Lab for Community and Behavioral Health Policy. Also on the team, we have Dr. Matthew Kelly, who's an associate professor of urban studies, and he directs the Action Mapping Project. And he's going to be talking about the application of that to the youth wellness hubs. Next slide. Next slide.
It should be advanced to the next slide, but you're not seeing it.
Okay. Great. I think I went out and now I'm back. And we also have Dr. McKenna Parnas, who's a postdoctoral fellow with the Co-Lab and in the Department of Psychiatry as in a T32 fellowship, and is working with us on various aspects of the project, particularly the social network analysis that's being overseen by Dr. Tyler McCormick, who's an associate professor of statistics and sociology at the University of Washington, where he looks at data that are sparsely observed or measured with error. We're very excited about this team, and then Dr. Alyssa Stitch will be coming in and doing our commentary at the end, and she'll be presented then. Next slide. So talk a little bit about youth wellness hubs, and then a little bit about our research aims. So the idea of the youth wellness hub is a planning structure that takes inspiration from place-based collective impact models of health interventions like the Harlem Children's Zone, but with a more specific focus on mental health. So the Youth Wellness Hub is intended to address the significant fragmentation in current child and family serving systems. I'm sure this audience is well aware that the US is in a child mental health crisis with rising ER visits, longer and longer wait lists for care across the United States. Even prior to the current crisis, the child and youth mental health system was plagued by high workforce turnover, inconsistent service quality, poor access and engagement among families of color due to distrust and non-culturally responsive services. As a result, communities overuse crisis systems of care like foster care, emergency rooms, and the juvenile justice system to address behavioral health and mental health needs. So to avoid the use of these systems, communities need to develop more reliable and responsive tiers of care, in addition to addressing social determinants of health, including safe places to play, neighborhood conditions, economic stability, housing, and social cohesion. Next slide. So the Youth Wellness Hub focuses on providing communities with planning tools and supportive infrastructure for local governance using a continuum of care framework from built environment through prevention, mental health services, and crisis care. Community governance is hyperlocal and mapped to encompass areas that residents identify with, as Dr. Kelly will further explain. And this is expected to foster personal commitment to collective action, as Drs. McCormick and Parnas will describe. So our study with Robert Wood Johnson Foundation will particularly focus on the feasibility of the community and service sector mobilization and the willingness of funders to pool resources to fund the community plan. Our team's been meeting with community residents and leaders for the last 9 months. We're now beginning the first phase of community mapping and outreach. After the research presentations, we'll have community commentary from Dr. Priscilla Lisicich, the co-founder and former executive director of Safe Streets and a key partner in the Youth Wellness Hub in Parkland, Pierce County. And I'll now hand it over to Dr. Kelly.
Thanks, Sarah. So I'm Matt Kelly, and I'm working on this project to define our catchment areas. So the catchment areas for the wellness hubs, these are essentially the bounded spaces that contain the populations that we'll be working with during the project, the populations as well as the agencies and organizations that'll partner with us. To do this, we're drawing largely on GIS, spatial data analysis, and I should say that GIS, it's in the title here, stands for Geographic Information Systems. It's what I do at the university when I teach. We basically teach how to make maps, analyze spatial data, and then identify patterns in those data that exist in space. So to define our catchment areas, we're challenged a couple of different ways. First, that usually the areas that we're referring to, like Parkland, Washington, for this project, don't exist in any real way. It's this is a place in unincorporated Pierce County. It's not an incorporated city. It doesn't have actual boundaries. It's imagined in certain ways. The census has designated it a place, which simply means that it's an idea that exists in Pierce County, and there are some block groups that correspond to it. It's also a community planning area for Pierce County government and the local health department. So there are some edges to Parkland, but the edges are more rigid than the everyday lives of the people that live there. So what we're trying to do in this project is to define a catchment area that respects a few different aspects of everyday life, so that it captures really the essence of what Parkland, Washington is. We know that people don't adhere to edges of cities. Their lives don't start and stop at the edge of a city or at the edge of a census designated place. That's just the reality of how we live. And we also know that there's functional barriers in our landscape that we have to overcome in our everyday lives. So we're thinking about these things as we're mapping catchment areas. And at the same time, we're thinking about who's living where and where those folks are as we're organizing. So you can click the next slide there, Maggie. So we have really 4 requirements, conditions that we want our catchment areas to meet. First, we'd like for our catchment areas to conform closely to official boundaries. So whether we're working in Parkland, Washington, or Seattle, Washington, or some city in the Midwest, we'd like for the catchment areas to conform somewhat to those edges. We don't need hard edges, and we really shouldn't be looking for hard edges. In Parkland, that means we're using the CDP, the Census Designated Place boundaries, the county health department planning area boundaries as a starting point. We also are paying very much attention to the lived or relational experience of residents that's invisible in secondary data. And this is where a lot of my work comes in. My background is in participatory community mapping and engaging with youth in particular to develop new forms of data about lived experience. So the lived experience data, which I'll show you in the next slide, is coming from the Action Mapping Project, and that's through direct engagement with youth in the youth and families in the Parkland area. Third, we want to ensure that our catchment areas actually contain the populations that we're interested to serve and to work with, and that's youth and families. So we'll be drawing on census data necessarily to do that. There's really no other good secondary data that's going to tell us much about where youth and families are in a place. So that's our census data. And then finally, catchment areas need to reflect the functional landscape of the region. And functional landscape means a few different things. First, we're exploring boundaries, edges of the rough area of the census designated place in the Pierce County planning area called Parkland. And those include things like freeways, a local military base, arterial streets that we know kids are hesitant to cross, the city boundary north of Parkland, things like this. We also are interested in the local geography of key services. So those partners that Sarah just talked about, where are those? We want to be sure that things like schools, hospitals, social service providers exist within the catchment area, because those will be our key stakeholders as we're moving forward. You can go to the next slide. All right. So we've got three maps here on the screen. The first map there on the top left is just kind of a rough idea of what lived experience data look like that come out of my work with kids in Parkland. It's a heat map that indicates, for our purposes and for local folks that work with me on that project, where youth spend time in the Parkland area, darker areas where kids tend to spend more time on out to the lighter areas. So we're getting a good sense from kids and some families, where do our lives start and stop? What are our activity spaces in the Parkland area? Now there's communities around Parkland like Midland and Spanaway and Frederickson that butt up against Parkland, and lives tend to overlap with those areas. So we're really trying to be careful about both capturing Parkland and also enabling folks who might live in like technically live in a place called Midland, but also spend most of their time in Parkland, that they're included in the project. So we start with our relational data and our functional data, which are our edges. The edges aren't shown on this map, but to the west of that heat map, we've got a military base. To the north, there's an arterial at the southern edge of the city of Tacoma. And then we have arterials on the southern edge and the eastern edge. Those in combination with the official designated, the boundaries that the county and the census has defined. Using all of those, we arrive at the polygon in the middle, which is our population density map. So all of those block groups are included in what is our kind of draft catchment area that we're working with. That draft catchment area I've here visualized just with population density data from the Census Bureau, darker blue being where we have higher population density, on out to the white where we have very low population density. And there's the northwest corner, and then on the southern edge, we kind of have this snake moving up through the central corridor of Parkland that it aligns pretty closely with the main arterial that runs through Parkland, Pacific Avenue. On the right-hand side is our youth density. We see more families in the eastern side of the Parkland catchment, and then some spottiness up in the north, and that has to do with development patterns where we see our grocery stores and shopping centers and things like this alongside residential parcels. The eastern side of this Parkland catchment is more rural than the western side, and that's interesting and helps to diversify somewhat the population that's served by the wellness hub. I think you can click to the next one. All right. So in working with these data, one of the challenges that we come across is that block groups, they tend to be chunky, and at the resolution we're at, they don't tell us much about what's going on at a higher when we magnify. When Safe Streets, our organizing partner, gets involved and wants to actually get on the ground and do something, we want to provide a little more direction. Parkland is the catchment is a fairly large area. Well, not terribly large, but it's large enough that we want a little more specificity. So what we're looking at here in the first slide is a surface that's generated by taking into consideration a few variables from the census at the block group scale, that being the percent of kids in a particular block group that are under the age of 18, the percent of family households in a particular block group, and the percent of households that, the percent of households that are families, and the percent of family households that actually have kids under the 18. So those variables we took into consideration, indexed, and then interpolated out to create a smoother surface so that we can think more clearly about what the pattern of youth and family residence looks like in this catchment. You'll see, we've got this snake running through this central corridor of Parkland, really from the southeast up to the northwest. To magnify that just a bit more, the image on the right is a map of parcels that are pulled from county government data. Those parcels, we extracted just residential parcels and then attached our youth and family score to them. So we can now, Priscilla's group, Safe Streets, and our organizers and my team, we can talk about where we actually expect to find kids and families in the Parkland area, not just where we have block groups with higher concentrations, but where do we have parcels where people live that intersect with where we'd predict there be kids and families. And that aligns fairly closely with what our relational data from working with youth are telling us already, where their homes and where they tend to live. So on the right, the darker green parcels, those are houses and apartments where we'd expect kids to be, and the whiter is either vacant land or developed property or parcels that don't have a high predictive factor that there would actually be kids there. From here, we're handing off to our organizers, and they'll be in the field in those darker green areas, really looking for the stakeholders, those agencies that can act as gatekeepers to open up doors for us. So just to recap before I hand it off, we started by blending official designations of Parkland with youth experience data from AMP, and then also our functional data from the region. We arrived at kind of a regular shaped area that is inclusive of the area we want to serve. And then we pulled census data to develop an engagement strategy for the area. And we're right now at that point where we're developing that strategy and thinking about how organizers get out in the field. I think I am just about out of time, so I can hand this over to Tyler.
Thanks very much. And I think actually we want to go to McKenna.
Thanks so much, Matt. So I'll share a little bit about social network analysis as an overview. I'll have Tyler jump in and add his expertise, and then I'll talk more about how this relates to the youth wellness hubs. So social network analysis is a method of exploring social structures. It seeks to understand the networks of relationships and their participants with really two main areas of focus: the actors within networks, so these may be individuals or organizations, and also the relationships between them in certain social contexts. And mapping social networks can be really useful for examining how stakeholders interact with one another and influence one another. And the visual nature of the social network analysis, which you can see here with these little red, yellow, and blue visuals. So the visuals and the systematic approach kind of offer insights related to policy decision-making. They can guide strategies to engage key stakeholders. And the network structures are characterized in terms of these nodes. So these little circles that you see, these are the individual actors or organizations, and the ties that link these folks together. So these represent the relationships or interactions. And Tyler, if you have anything to share specifically about SNA. No. So Maggie, we can go to the next slide. So in such an initiative like the Youth Wellness Hubs, social networks can emerge from collaborative relationships, thinking about information or resource exchange between stakeholders who have interest in achieving a shared objective. And social networks facilitate information sharing and collective action. And the patterns of relationships and characteristics of such networks are really important to explore as they facilitate effective governance processes and positive outcomes. So we are using this tool to explore processes of community knowledge exchange and multi-sector collaboration for the Youth Wellness Hubs. And we're going to characterize the relationships between stakeholders and explore social connectivity and how this may influence decision-making. Data for the social network analysis will be collected via online surveys and completed by participants about once per month using personalized links to connect their data over time. And we will collect data from a sample pool of participants, including all folks who are invited to participate in the Youth Wellness Hub's biannual strategic planning process. So this will involve members of Community Governance Board, social service agencies, medical agencies, policy and divisions within the local public health government or public health department. The key social networks constructs we hope to explore include the size of the county multi-sector networks, changes in the cohesion of the network, and changes in information brokering activities. And these are activities that facilitate connections between two separate areas of the network. So in a social network map, as I showed you on the last slide, each circle or node is representing this actor, so individuals from organizations. These are color coded according to the type of stakeholder, and the size of this node represents the level of influence that the actor has, while the arrow or link between nodes represents the interactions between actors and the direction of the influence. So understanding these connections between actors will be important for the Youth Wellness Hubs project because these connections will lead to facilitation of communication and exchange of resources, and the size of the nodes within the network will also highlight who the most influential actors are in this process. We will also ask questions about the overall connectedness of members in the network, otherwise thought of as cohesion. So cohesion indicates the degree of redundancy within a network. So if all actors within a network were directly linked to each other. And cohesion really benefits the flow of information and knowledge within a network and drives collaborative innovation because it facilitates building trust and maintaining trust and developing common norms and ideas. So we expect greater cohesion will have positive effects on the transfer of information and knowledge related to adolescent behavioral health for the Youth Wellness Hubs. And we'll ask questions about this by having participants identify who they interact with from the participant pool related to adolescent behavioral health. And the degree of cohesion is calculated as the number of ties between actors realized divided by the number of possible ties. And then importantly, information travels across separate networks through brokers or actors within a network who can link actors of separate networks by bridging ties. So these brokers are important because those who have really good reputations can help mediate building and maintaining trust across separate networks and can enhance the extent to which information is transferred to other partners. So in the context of the Youth Wellness Hubs project, brokers may include people or organizations that spend time and resources engaging both with funders and community partners, serving an additive function to providing access to information. And questions around this may include who a person would go to if they needed recommendations for strategies to support adolescent behavioral health. And finally, we're going to ask questions to understand participant perspectives on what are the main issues that need to be addressed and what are the resources needed to support adolescent behavioral health for the Youth Wellness Hubs. And we're going to explore how responses to these questions change over time to assess whether multi-sector agencies demonstrate greater consensus throughout the strategic planning process. And I think that wraps up this part. So the next slide.
Great, I can jump back in and introduce Dr. Lisicic, who's going to be providing some of our community commentary. Dr. Lisicic was one of the 24 founders of the Safe Streets campaign. Safe Streets is a nonprofit operating throughout Pierce County around community mobilization. She served as the first primary architect to design a community engagement effort to reclaim neighborhoods, business districts, school zones, legal activity and violence. She recently retired as the executive director of Safe Streets and now serves as an expert consultant for community engagement strategies broadly and specifically for this project. I will let folks kind of read some of the other text here on the slide, but particularly want to highlight a few things. Dr. Lisicich has really deep ties within the Tacoma area around community engagement for youth wellness. She's been an extraordinary asset to this specific project in Parkland, but also broadly as a subject matter expert for the SAMHSA's Community Engagement Toolkit Guide. And she's received her doctoral degree in community education and community organizing from the University of Michigan. So Priscilla, I will hand it off to you to provide some of the community commentary.
Thank you, Sarah. This is such an exciting project to bring this to the Parkland community. As Sarah said, when Safe Streets was founded in 1989, as many communities were kind of on their knees, as our chief of police said, face down flat in the mud, with illegal gang activity and unparalleled violence, drive-by shootings, and so on and so forth, recruitment of our children. So this was a community response. It was a very fledgling community response, which actually worked and engaged people to get them more involved in taking responsibility for what was happening right down on their neighborhood block. It was brought down to a very small catchment area individually and was very focused on crime. So over the years, Safe Streets, Parkland was one of the communities that showed up, that said, we really need to be a part of making a difference and taking our, restoring safety to our community, but also looking at some of the things in the built environment that were distressing, parks that had been abandoned. The county basically wasn't taking care of those parks anymore. If you go and walk around Parkland, there's not a lot of the walkability is challenging. One of our neighborhood leaders often talks about how she's lived in Parkland her whole life, and she is 70 some years old, and she said, I've never had a sidewalk to walk on. So it's an underserved, it's a stressed area, and it's a very high poverty. It's somewhat rural, as Matt described. There are a lot of different residences, and it has a diverse population. And in particular, most recently, with people coming from Central and South America, the Latinx population in that area is quite stunning. And in fact, if you call the school district, Franklin Pierce School District, you will hear English, but also Spanish. And I know when I call different districts, I don't often hear the Spanish language being used. And so the idea that we need to respond, to people in a community way to understand what is going on in the community is important. So community mobilization is the Safe Streets model is really a neighborhood-based grassroots organizing. So it's critical for this project to build the Youth Wellness Hub community boards, and if we're seeking to achieve 50% resident participation on our governance boards, then we really need to, in a sense, walk our talk. And so we have experience here. We've been able to make some dramatic changes in that community, but there is so much more to do. When we launched the Youth Wellness Hub idea, I worked with I was then with Safe Streets, and I worked with Dr. Walker to reach out. And the next slide, I think, will give you an idea of who some of the community partners are, where we've built a wonderful coalition and made up of the schools, juvenile justice, healthcare organizations like Multicare and Virginia Mason Franciscan Health, Blue Zones, which is a new initiative really focused on improving the physical health of people in the area, and Parkland and Spanaway were selected because they were the most distressed area that could really benefit from a focus of helping people to learn how to eat more healthy, exercise, and be conscious of being able to promote fresh food into neighborhoods. Neighborhood groups from Safe Streets, there are business districts, the Rotary showed up, they're involved, our health department, youth in the community, churches. We are really working with many of the churches. Some of them really serve as the anchor, treatment organizations, other social services, and then in general, community activists. And this coalition is very much interested in making sure that we're bringing community voice to the table. And as many of you probably have experience in, that that voice done in the right way, as we're trying to focus on, is it will help us shine a light on the structural inequities that exist, that are influenced by the social determinants of health. So this highly underserved community, if you walk around and if a young person, for example, needs to get access to mental health services other than through the school district, you cannot go to a facility that will assist you. Most of the facilities for social services and health services are kind of outside of that boundary that Matthew talked about. But there is a significant population, of course, that's living inside that boundary. So by being able to create these voices of community members, boards, and get them connected with the social services and getting the interactions going, then the community will be able to define its needs. And then we can start helping to, I always call it triage. We can kind of triage services in and try to reach out to certain groups or certain entities that may not be directly serving that Parkland community at this point. So I'm really excited about the research on social networks because I think that that will really help keep us accountable. People in this community, I think the importance of this research is, and the impact on the community is, if we are able to build these community governance boards in areas where they will make a really big difference, and then we have an accountability, we're measuring the change by collecting data from the social service organizations, the coalition partners that you see here, and being able to keep our feet to the fire, so to speak, we can actually look at where we're having trouble. So again, back to Dr. Walker's original picture of what this will do is, instead of organizations being funded to come in and serve an area, this will be from the bottom up. So it's exciting to see that we're building on an effective organizing and engagement model that will lead to better outcomes for the community itself. I think I'll stop there.
Thank you, Priscilla. Carrington, I think we'll hand it back to you to facilitate with Q&A. I do see a couple already in the box.
Yeah, that's right. Thank you so much to the research team for giving us an update on what you've done so far and what we have to look forward to. This team is funded to do a 12-month research project, so we will have them join us again for another research in progress webinar when their project is over, so they can share some final findings. So stay tuned on this research project as it's ongoing. Let's move on to the Q&A portion of today. We have about 25 minutes or so. So if anyone has any questions at all, please enter them into the Q&A box. I'm going to get started with our first question from Chris Hollis, which is about selecting the catchment areas. They're curious if you were looking for areas that were more adequately resourced, potentially areas that had more hospitals and those kind of resources in the area.
I can take part of this, and then Sarah, if you want to jump in, you can say more. So the location of hospitals matters. That's part of the functional landscape that we're considering. We're starting though from Parkland. So we really started with a neighborhood, a community in mind, and that's the reason that we're blowing up the catchment area, and we're not just going with the census designated place boundaries or the county planning area boundaries, because we want to be sure to include as much of those other functional parts of the community as is possible. So as far as resourcing, there's not a hospital in Parkland. There are hospitals nearby to Parkland that have catchments that overlap with our own catchment area. There's small clinics and social service providers that we're ensuring are contained within our catchment, but that's I think that may not answer. Sarah, do you want to add?
I thought that was great, Matt. To just reiterate the point, the focus for planning is primarily on sort of the distressed region or just the catchment region that is relationally and functionally defined by residents. So the sense of identification with the place is really important. But as you like on one of the sort of 4 considerations for how big to draw the space, the other consideration is, can we stretch the boundaries of that to include service sectors that can then also be, coordinated to better serve the area? But in cases where there's really not the services that we would like to see, the focus of the Youth Wellness Hub would be to try to bring those services into that space. So our effort in Parkland is early, but we're connecting with many other initiatives that are doing place-based collective action. So for example, Multi-Care is an organization throughout the state that is in Parkland and is also serving another kind of health zone in another city in Washington state. And one of their recent efforts was actually to build and now staff a new outpatient behavioral health clinic for a region that previously didn't have sort of a standing outpatient service sector. So that's sort of one example of how the hub would work to bring in services if they're not already available. But we would hope to sort of draw a large enough and then all services from the ground up. So it's a bit of a balance, and as Matt's maps kind of showed, it's a fuzzy edge.
Yeah, I had an interesting conversation with someone from Multi-Care not too long ago about mobile clinics and their desire, at least at Mary Bridge, the Children's Hospital, to think about where mobile clinics might work in a place like Parkland, where you have a lot of socioeconomic distress, no good access to healthcare, but we don't know much about the relational landscape of the city just yet, or of the region just yet. So I think that the work we're doing helps to inform those kind of processes at all also.
Yeah.
Great. Thank you both so much for addressing that. And move on to our next question. What local data did you use to identify the residential parcels classified by presence of kids and families?
Sure. I think that's me again. So as anonymous attendee probably knows, there is no good local data that will tell us where kids and families live. And if you work with these sorts of data at all, you know that those data don't exist. So we have to do our best to emulate what those data might look like. So to do that, we pulled together 3 sets of data. One are just county scale parcels that from which we extracted only residential parcels. So if you work at all in GIS or in data, I suppose, then you might be aware that parcel data exists. Parcels define the areas where we can build in public space. So parcels we pulled residential from. That means that we know where all of the possible houses in Parkland are. And then we attached our predictive surface, which is like a heat map of where we would expect to find youth and families. And that's an index of data that I interpolated out to the city, or not to the city, to the catchment area, and then attached to those residential parcels. The final step here is to overlay data directly from youth and families, telling us here's where we tend to identify as our neighborhood. So one of the questions that I ask kids and families when I work with them, and I could go more into what I do on the relational side, is I ask people to draw small outlines around where their neighborhoods are on a piece of paper or on a digital map when I meet with groups of kids and families. All of those data that people draw, and we're talking about hundreds or thousands of drawings because we're working with a lot of kids in schools, I overlay and we see a heat map like that map you saw in the slide, which was where kids tend to spend their time. We have a similar map that indicates where kids and families identify as their neighborhoods. Those neighborhoods that they've drawn align pretty closely with the predictive map that we have of parcel data. So we have really 3 sets of data that help us to drive down, nail down where we might, as organizers, find kids and family. It's not perfect. There's error built in, but it certainly opens up the ability to do a project like this without just going out blindly into the community. So.
Great. Thank you, Matt, for addressing anonymous attendees question.
Sure.
Do we have any other questions from anyone in the audience? We definitely have time for it. Okay, I see another one came in from Libby. Can you share more about how the community defines what creates youth wellness, which informs which services are needed?
Thanks, Libby. Libby is a collaborator of ours. We did our first community survey, and we're asking about youth wellness 4 different ways. And we're asking community residents to rank what they see to be the highest priorities for youth wellness. Again, we're really focused on achieving impact in youth mental and behavioral health. But to do that, we're also mindful of the many layers of influence on health, from built environment, social determinants of health, family ecology and environment, as well as actual services. So we are asking families, community residents in the Parkland region to tell us about diagnoses, because that may be one way that families think about mental health. But we're also asking families to prioritize needs around support. So that could be housing, economic stability, safe places to play, their school environments. We're also asking them to tell us what they would like to see for youth wellness as goals. So goals for school engagement, goals for employment opportunity, goals for youth feeling confident and good about themselves. So we have multiple ways that we're trying to get to the idea of youth wellness that's bounded sort of by broad definitions for mental and behavioral health. So those will go out to community residents. We'll get those rankings. Sorry, my video seems to be going off at the most inconvenient times. It's like completely stayed on through all the other presentations, but when I'm talking. So I think I talked about sort of our 4 areas that we're assessing needs around. I think I'll just go off video for this. We'll take those priorities and we'll look across those ways of asking about wellness to derive what seem to be really common priorities and that will drive sort of our health area in mental and behavioral health. And then we'll be looking at service delivery systems and built environment and building plans along the continuum of mental and behavioral health wellness that hone in on that specific aspect of mental or behavioral health that's really important to the community. So that could look like substance use, that could look like youth self-harm, that could look like anxiety or school engagement or school avoidance. So we'll get very specific about the areas of health to improve, and then we'll look at how the service delivery system from built environment to crisis care is organized to support that health outcome.
Great, thank you, Sarah. Moving on to our next question from Amber. It looks like Priscilla would like to answer this one. I'll go ahead and ask it to you. Maybe you can be the first one to address it. How could you partner with housing or affordable housing to also help locate families and children? Are there opportunities to scale this work to other locations?
So I'll take the first part, and then I think Sarah might want to talk about the other. But we are already, through Safe Streets, through our neighborhood organizing, we've already been deeply connected with the housing authority. Pierce County has a housing authority, and there are initiatives that are underway with the county, with Pierce County, around affordable housing. So while we're not on that initial coalition partner list, we've got them on the list of an entity that we need to reach out to. Now, what is interesting, and it would be interesting to go back to Matt, and I'm glad you asked this question, is that the housing authority does not have any property in what is considered to be the Parkland census area. They have property around the edges. So and we are actively working with those apartment complexes in particular. So it is a high need, and we are in deep discussions. At least Safe Streets has been, and part of, and I have a role with another advisory board where we're really looking at trying to look at that intersection of the need for affordable housing in the Parkland area, the need to make sure that we're keeping the opportunity for people to be able to pay their rent affordable. So it's a work in progress, and I think the question you've asked has really highlighted the need for people to be engaged in thinking about that. And about scaling work to other locations, for me, it's if we can, as we really focus on this project, we can then bring this to people in other parts of the county where there is a need there, but also other communities and other parts of the state. So in Washington State at least, but possibly outside of that.
And I'll just add quickly to that, to Priscilla's great answer around scaling. So we're very interested in scaling because ultimately this project is about governance. So we're very interested in looking at the feasibility of county or city governments adopting sort of a different way of investing in community. A lot of investments right now from government to community are project-based, or just, single nonprofits to run a specific service or project, and those aren't always coordinated. We think that if there's a shift in funding to something like a local planning entity, like a youth wellness hub, that we can be, could be more successful in aligning on the ground services, particularly across the continuum. So that's explicitly one of our research aims, to see if there's increasing willingness and openness to that question, and then working, of course, within Pierce County, but we're also in conversations with other kind of local governments in Washington State around the openness to that idea for government investing. So we really are interested in shifts in governance.
Great.
And
Thank you
I just, there's one more thing, if I could add. um, when we were talking about the interactions and the mapping, I'm really, what is, I think, exciting about this project is that Dr. Walker and her team were really, really interested in making sure that they connected with people who had connections out into the community, into where people live and where young people hang out, and where people shop and all those sorts of things, where they pray. And so it's the foundation, is part of this foundation is very strong in terms of relationships. And as I have done my work over the years in community engagement, you have to build those connections between people. And so that balancing of making sure that we're listening to what people are saying and that we're thoughtfully building this coalition of strong partners that they've now made a commitment. They've signed an MOU and said, we are going to bring our best thinking and our resources. But I love the fact that we're looking at social networks, because I think the foundation here is the relationships that already exist in the community.
Wonderful. Thank you.
Thank you.
I'm going to skip around here and ask a question that came in from Gloria, which I think will dovetail nicely after your response to that last question. But as we identify CBO participation in the establishing functional landscape, what incentives can be considered to offer for active participation and capacity building?
I might answer a little more broadly than just the functional assessment, but we'll also kind of throw it to Matt after I say a couple of things, just largely about recognizing community engagement and how the project is doing that. So we are in the process of contracting right now through Safe Streets with a community resident to largely hold community outreach pieces of the project. So longstanding resident in the Parkland region, connected to a lot of folks. The specific information gathering activities, surveys, for example, are there's a lottery sort of for participating in those. Because we hope to gather a lot of responses. So we wouldn't have funds to kind of incentivize every response to a survey, for example. And then I might pivot to Matt around some of the mapping activities specifically and how youth are typically incentivized to participate, or how community is incentivized to participate. Going forward, when the community board infrastructure is put in place, those are community residents and they are stipended positions, so that community residents are paid for their time to participate in planning. But Matt, did you want to add anything more to that around the mapping activities?
So it's interesting around mapping. I generally don't incentivize participation within the work that I do. Now, I think we're talking about two different things here. When I work with individual residents in places, whether those are in schools or community meetings, the incentive is that folks are expecting to participate in a process that leads to response from local government. And so ensuring that response actually happens is pretty key to maintaining that trust between my team and the folks that we work with. I think the CBO participation, I wonder if that's a different sort of question that is maybe outside of my domain on this project. We're looking for CBOs. We're interested in that functional landscape, how they participate in the project. I think, like with individual participants, if agencies see a response coming out of this, and this isn't just an academic group helicoptering in and helicoptering out with some data, then I think that there's desire to participate in projects like this that have outcomes that are tangible in the community, and that's really key. I don't know what else to say here.
I think that's fine. Thank you. Let's see here. I'm gonna move to a question. We have about 5 more minutes, maybe time for 1 or 2 more questions. Amber asks, would this model work for an adult population? I guess I'm going to expand on that, and we can kind of go back to maybe like the scalability of this project, not just only working in other locations, but potentially is this generalizable to other populations as well, not just the adult population, but other populations.
I can take that one. I mean, conceptually, yeah, I mean, yes, that would be the hope, that this is really more about a governance infrastructure. We're particularly interested in impacting youth mental and behavioral health. And so sort of the information gathering strategies and synthesis and planning, back end parts of that are really informed by that area of health. But as a governance infrastructure, you know, this is really taking a lot of cues and inspiration from the political science literature on co-production, ways of engaging residents more directly in governance planning, and just trying to put kind of a replicable structure around it so that governments can sort of see something tangible to invest in that would have a predictable sort of rhythm and process and structure and outcome. But I would think that this is fairly health area agnostic at the highest level of just community governance, and you could kind of plug any other sort of need into that structure, whether it's housing or adult mental health, for example.
Great, thank you. I am going to ask 1 more question. I know we only have 3 minutes, so maybe we'll keep the answers short, but Gregory has a question for each one of the presenters about why should the audience pay attention to what happens with this project, which I think is just gets to the heart of like why this research is important. So if you want to each maybe address that quickly, and then we can move on to some announcements and close out for the day.
Well, why don't I start, and then folks can be preparing their responses since it's to everybody. And maybe I'll go next to Priscilla and Matt and Tyler and McKenna as I see you guys down the line if you just want to say 1 or 2 things. Well, of course, I'm very interested in this because I think we're going to really get a better understanding of the feasibility of this type of collective planning as a feature of ideally routine governance. You know, we really want to demonstrate something that funders, both on the kind of payer side, on the philanthropic investment side, but really from the government side, that folks can see some benefit here to investing in local planning efforts as a way to then also invest in specific services. So that's why I think it's, you know, useful to keep an eye on it. Priscilla?
So the model is really bringing that community voice, and it is building accountability, and what will come out of the project will be something that could then be taken to other communities. So I just think it's really critical, and it can be replicable, but it needs to be put together so that the community voice that will drive what the need is. So back to that other question, adult populations, it could be people with disabilities. I mean, it's just goes on and on. Thank you. Oh, Matt, you have something?
Oh, sure. I'll just say quickly. Yeah, I think that I was going to say something similar to Priscilla, foregrounding this idea that we don't need to adhere to our secondary ways of seeing place and understanding community, but we can generate new ways of seeing, and then respond to problems by listening to people and understanding landscapes and areas differently. That excites me, and I think it's a great approach. And I think that was going over to McKenna maybe.
Yeah, thanks, Matt. I just think as researchers, we have responsibilities to shift the way that we've been approaching these kinds of questions and work with communities. I think communities really know what they need, and funders have the resources to be able to support that. And so as much as we can use our own tools and resources to facilitate those processes and communication, I think that is really important, and something I'm really grateful to be part of. And I think to Tyler next.
Great. So yeah, so just echoing what my colleagues have said, I mean, and also just kind of emphasizing on the network piece, sort of understanding where the sort of potential sort of communication information bottlenecks might be. And then over time, as we're kind of working together with folks, seeing how ideas and strategies maybe from people who previously were communicating less, as they start to communicate more, how those strategies might influence one another and how they might come together to come up with new and unique solutions. And again, I'll echo what McKenna said, and I think this is very exciting, and I'm happy to be part of this team. And I think, I'm not sure who I'm supposed to toss to now.
I think you closed it out. I think everyone spoke, so good. Yeah. Well, we certainly acknowledge the importance and of your research, and we're happy that you joined us today to provide some wonderful updates, and we're excited to learn alongside with you as you complete your year-long Systems for Action study. And I think with knowing that we're 1 minute over time, I'm going to just email the announcements that we have from Systems for Action along with the recording and PDF of these slides. So I think we can go ahead and close out for today, but thank you so much, everyone, for joining us. And I hope you have a wonderful rest of your day and rest of your week. So long.